Fulton Dekalb Hospital Authority has served the indigent residents of Fulton and Dekalb counties. The FDHA is the proud owner of Grady Memorial Hospital and all of its health systems.
The reality is in Fulton County, especially also in DeKalb County, is we have health care disparities in our communities. And so I think the hospital authority does a great job in terms of addressing those issues.
The FDHA exists to ensure that the indigent residents of Fulton and DeKalb counties receive quality health care through the Grady Health System.
Grady Hospital is an institution that has been here for many, many years. It's the anchor, the mainstay of the healthcare delivery system.
Grady has identified the following gaps in healthcare that plague our community of Fulton and DeKalb counties. In an effort to address these research-based findings, the areas that received the FDHA's focus and resources to achieve the greatest impact are identified in the pie graph. As an actionable approach to alleviating the gaps, the FDHA believed it was imperative to prioritize improving the engagement of the community and emphasize the importance of taking preventive health measures to avoid chronic diseases altogether. The FDHA achieves its mission by engaging the public, helping individuals and families make informed healthcare decisions by sharing preventive health information, educating the community on a range of healthcare services available by providing resources and connecting the community to programs and services.
We have a big focus in the FDHA on prevention. So we're working with youth, we're working with school children, we're also working with other adults.
Advocating for the medically underserved population of Fulton and DeKalb counties and for meaningful health care policies for the people of Georgia.
At Carrie Steele Pitt's home, we are able to provide care, residential services, transitional living, independent living, as well as a host of other programs where we are able to reach the community through after-school, summer camp programs, and many wellness programs. This Fulton Dekalb Hospital Authority grant makes it extremely possible that we are able to reach underserved, vulnerable youth in the community to make sure that we are addressing preventative health care needs as well as chronic conditions that the youth already have when they are placed with us.
Providing grants and collaborative partnerships with community organizations are two of the actionable approaches the FDHA used to address the healthcare gaps in Fulton and DeKalb counties.
The Ryan Cameron Foundation is basically an organization that empowers youth for life skills, also for education, and also for healthy awareness. The support of the FDHA helps us serve our community in a very specific way. When you promise a kid that if they graduate from high school that you're going to support them with a book stipend or you're going to make sure that they can have a health fair, you make that promise, you're going to need some money to back that up. And with the FDHA, they make sure not only is that possible, that we follow through with what we are saying we're going to do.
Hosting annual health summits is another actionable approach the FDHA uses to address the healthcare gaps. The 2013 Health Summit focused on the impact of the Affordable Care Act, and the 2014 Summit addressed mental health.
We tried to focus on the whole challenge of mental illness in our communities to get individuals to understand that mental illness is just that. It's an illness, and to understand the devastating impact that it has on individuals, on families, and on our communities.
I hear that each of us has to be an advocate in our own way. That when you're looking at something and it may not look right, sound right, feel like, be willing to make a call or to go somewhere to ask for help. We have a clear demonstration that people with mental health issues or well-mind issues can be healed, can recover, can go forward. There's still some areas, mental health and disability, that need to be merged and that we need to work together. But we've got a mental health campaign being birthed right among us.
In 2015, violence, America's challenge.
There is a correlation between mental illness and much of the violence we are witnessing in this country today. But even more so, when you turn on your televisions every morning and when you turn on the radio and when you look at the publications, the daily publications, all we see is violence. And so what we wanted to do with our conference is to address this whole issue of violence, America's challenge.
We're not going to be able to recover our community without our faith leaders. Our faith leaders have the mic. They speak to the hearts of our people, and we have to make sure that there's a social justice component that we're also talking about when we go to worship center.
In 2015, the FDHA was the first to launch the Network of Care database in Georgia. The database is a tool that individuals, families, and health agencies can use to identify and assess local health outcomes down to the zip code level for Fulton and DeKalb. Healthcare gaps of Fulton and DeKalb counties will never be adequately addressed by working in silos. Therefore, the FDHA invites you to get engaged and help identify new opportunities to collaborate in an effort to extend its reach through partnerships or sponsorships. The FDHA works with organizations that focus on reducing chronic diseases and provides services that are underrepresented in the community. And we are always looking for companies who share our passion and commitment for healthcare issues to partner with us in our mission to improve the health status of those we serve. To learn more about the FDHA, please visit our website, www.thefdha.org.